Alrighty, thank you so much for all of those that are joining us this evening. My name is Stephanie Padillo-Sanchez, Communication Specialist here at the Yakima Health District. For any of you that are new today, as a reminder, these updates will be in English one week and in Spanish the next. So our next English update will be on March 30th. Hola a todos, gracias por acompañarnos hoy en nuestra actualización de COVID-19. Un recordatorio, tendremos estas actualizaciones en inglés una semana y en español la otra. El próximo martes 23 de marzo tendremos nuestra actualización en español. So, por favor, únese a nosotros esta semana y si tiene alguna pregunta podremos responderla. So today we held a press conference to announce the opening of the drive-through community vaccination clinic at the Yakima State Fair Park. We'll be hearing from Nathan Johnson, local emergency response coordinator, to give us an update on vaccines. Additionally, on March 12th, the Yakima Health District was informed by the Washington State Department of Health that two Yakima County residents have tested positive for the South African COVID-19 variant. Dr. Yaka, Interim Health Officer at the Yakima Health District, will be able to give us more information on this. If you have any questions about the drive-through community vaccination clinic at the Yakima State Fair Park or the South African COVID-19 variant in Yakima County, please make sure to put them in the comments section as I will be monitoring it on Facebook. If you have any other questions relating outside of these topics, you're more than welcome to leave them in the comments and they'll be addressed at a later time, either via a different COVID-19 update or directly replied to on our Facebook. Okay, so first we will be hearing from Nathan. Nathan, what are some new updates? We know that the Yakima Health District held that press conference today at the Yakima State Fair Park.
Yeah, absolutely. Thanks, Stephanie. So as of this week, as a county, we've received 55,317 first doses into county. We've administered 39,674 of those first doses. We've also received 25,225 booster doses and have administered 18,462 of those booster doses. A big caveat with those is understanding we take that data from our partners at the beginning of the week, and that is the time period that they also receive vaccine from the state and from the federal partners. So that is why it looks like we have a bunch of unused vaccine. That's because we just got it into the county yesterday and today. So we are very excited. We continue seeing vaccine come into Yakima County, which is encouraging. We've seen the newest edition of the Johnson & Johnson vaccine, which adds supply to not only the country, but trickles down into Yakima County and getting more vaccines into the county. We know we get a lot of questions on if we will post what organization or what healthcare facility has what vaccine. We will not do that. We are really sticking to the message of the best vaccine is the most available vaccine. So please don't hesitate and wait for one vaccine over the other. All three of them are very effective vaccines, not only against protecting against COVID-19, but also protecting against severe health impacts if you do get COVID-19. So there is that. As far as this week, today is our last day of vaccinating 1B Tier 1 before we open it up to 1B Tier 2. And again, 1B Tier 2 is really our high-risk critical workers in congregate settings, such as our jail staff, our grocery store workers, our agricultural workers, people who are pregnant, and then also people with disabilities that put them at high risk. We understand that in Yakima County, about 63% of our workforce is essential. So we will see a large increase in how many people is now open to be able to get the vaccine with this newest edition that we'll move into starting tomorrow. So that's really encouraging news. It means more people will have the opportunity to get the vaccine, but vice versa, it means that it will put more stress on the limited supply that we are still getting into the county. Our supply is increasing, but it's still limited. on a week-by-week basis. So I really just urge patients within the community as they try to make appointments and appointment slots may be filled up. Don't give up on and not get the vaccine. Always be looking for different opportunities. With that, I do want to touch on our drive-through site. Here at the Health District, we've really been oriented on creating options for the public, low barrier, accessible, and equitable options throughout the entire Yakima Valley for the community to find ways to protect themselves against COVID-19. That includes things like testing and mask distribution, and now certainly vaccine distribution. We're looking at a lot of the models that we've used in testing and seen a lot of success with, such as having these drive-through sites available throughout the county, working with our healthcare partners to also have options available, and certainly in the future, looking at what targeted teams would look like to be able to go on site and get to those communities that have transport access needs and issues trying to get to a clinic or one of our drive-through sites. We're very excited to launch the drive-through site. It's in partnership with Signal Health and the Yakima Valley Office of Emergency Management, as well as the Yakima State Fair Park. This site this week is going to be open, very limited. We have about 500 doses to run through that site for the week, even though that site is built to do well over 500 doses per day. So we really wanted to take the time and really focus and make sure that our systems are in place and that anyone who goes through to get a vaccine, it's a very seamless process for them and they have a really good experience with that. So we're really focusing on ensuring our systems and practices are working very well in a very controlled manner. So in the coming weeks, we'll be requesting additional vaccine to support that site and opening up more lanes, and therefore opening up more opportunity for the community to get that vaccine. Again, this is just the tip of the iceberg. We have a lot of other planning efforts in front of us. People who are interested in utilizing and scheduling an appointment through the drive-through site, it is by appointment only. You have to go to prepmod.com or .org, and that information can be found both on the Yakima Health District's website, our social media, as well as Washington State Department of Health. The last thing I'll just mention is with the increase of individuals who now have the opportunity to get the vaccine, we always urge people to go to findyourphasewa.org. That's findyourphasewa.org, where you can go through some questionnaires and figure out what exactly phase you fit in and whether or not you're eligible for the vaccine or not. Long story short, we're really continuing to make really big strides with vaccine distribution in the county and continue to find different options to make this really accessible for the community.
Okay, thank you, Nathan. Looks like we don't have any questions from Facebook at the moment. So we'll move over to Dr. Yeka. Thank you, Dr. Yeka, for being here today.
It's good to be here. So I might just mention, as Stephanie mentioned, we did have 2 cases of South African variant. What does that mean for Yakima? It's nothing, doesn't really surprise us. We know that the nation has had a lot of variants. The state has had a lot of variants. So the last couple of months, the state has set up programs to test a certain percentage of all positives to see if we have variant strains. And from that, as of 10 March, they've had 105 variant strains throughout the state. And the majority have been what they call the UK strain, there's a Brazil strain, and South African. The ones we found here happen to be the South African strain. What does it mean for us? It just means that we have another strain, and the variants tend to be, they're a little more infective than the others. So that's a concern. We still feel that the vaccinations will be effective against them. And so it's really, we'd like to see the variants down to the lowest level we can. because we want to get out from under this pandemic and controlled. And as we vaccinate people and still keep our distancing and everything, this is the way we're going to defeat this virus. And so it's just to be awareness. It's nothing to panic anyone that since we have the variants here, it's nothing new. I'm sure we probably have all three of them. If we tested everybody, we would have all three variants in our county. But it's just kind of a wake up call that it's not over yet. We still have to. And now with the exciting news of another vaccine drive-through clinic, we're going to get there with the vaccinations and with the national priorities for pumping up vaccines. I think that's where the bright news is, I think, of anything is a vaccination. We get people vaccinated. And I hope that people out there that are even thinking that they may not want the vaccine to think again. They're very effective vaccines, most effective I've seen, and great technology. And I think it's a bright way to have vaccines for the future. And I'm hoping that we can have flu vaccines that will be that effective in the future. So with that, I'll just kind of pause, and if there's any questions or.
Okay, thank you, Dr. Yeka. Let me go ahead and check our Facebook. Give me one moment. Okay, so Smiley does have a question. When will there be separate data of vaccinations available? I'm not sure if they are asking about the type of vaccine available.
Yeah, again, we will not post what provider has what vaccine at any given time, because that can change on a week-to-week basis. Just because a provider gets Pfizer 1 week doesn't mean they won't get Johnson & Johnson the next week. So, but also to that end, again, not sure that the realm of this question, but if the question was oriented more on racial and ethnic data, around who's getting the vaccine, that's something that our team's looking at. We know that the state just recently, over the last few weeks, released it on a state level. So at this point, our team is not to that point of releasing that data, but it is something that we are looking at internally.
Okay, thank you, Nathan. And Smiley just replied and said yes by race and ethnicity, so you touched on that. And then there doesn't seem to be other questions, but I'll ask a few here. What are the hours of operation for the community drive-through clinic?
Yeah, thanks, Stephanie. Drive-through clinic will operate just the same hours as our Yakima test site will operate. So it will be open Tuesday through Saturday, 9 to 3. Aside from Thursdays, there'll be an evening option, so it will operate from 12 p.m. to 6 p.m.
Perfect, thank you, Nathan. And for people that are going to be eligible to receive the vaccine tomorrow, can they sign up for an appointment today?
Yes, absolutely. Sign up, work on signing up today. If there's slots in our prep mod, but also looking at other providers in the community. They're all aware that this change will happen effective tomorrow. So if you can get in tomorrow or later on this week, please, again, don't hesitate.
Okay, thank you. And Dr. Yeka, for people that are worried about the variant and other types of variants of the COVID-19, what are some recommendations that you believe they should follow?
The same ones we have been following. It is the same, it's spread the same way. It's really, we don't know whether it's, it seems to be a little bit more effective, but other than that, the vaccines are effective against it. The masks are effective against it. Distancing is effective against it. So there's really no magic to it. It's the same things we've been doing. I know it's getting old, but the light, I think, is at the end of the tunnel. I think if we can get enough vaccinated and the people, the community just really hangs in there a little more, we'll be in good shape. But don't worry because the variants are here. It's just we need to let people know. We don't want to keep it from people, but it's not that bad. It's just that we have to continue doing the things we have been. And when you've been doing a good job of it, so just keep it up.
Okay, thank you, Dr. Yeka. And let's see, let me check our Facebook. Okay, looks like there's no questions. For those watching us, we do encourage you to ask your questions. But I will go ahead and ask another question. Will people from other counties in Washington state be able to schedule an appointment at this location?
Yeah, absolutely. So following the governor's proclamation or mandate, I should say, it will be kept to Washington residents who live and work in Washington state specific to this drive-through site. And just like all of our other providers, we do not differentiate whether you're a Yakima County resident or another county's resident. So the vaccine is there, the tool is there. So anyone within the community as a whole can utilize that if needed.
And then just to follow up, will they have to show proof that they live or work in Washington state?
So they shouldn't have to show proof of living in Washington or working in Washington state. A lot of it, just like we have operated in the past, has really been off the honor system. Just like the 50 multi-generational household, there's really no way to prove that. We're not going to ask for in-depth proof. We're just going to take it at someone's word and administer the vaccine to that person.
Okay, thank you. And let me check our Facebook again one last time. Okay, so it looks like no one has a question. I'm going to go ahead and share my screen and just go over where people can locate vaccine locations here in Yakima County to schedule their COVID-19 appointment. Can you see my screen? Okay, so like Nathan was saying, everyone can use the face finder, and here you'll be able to see if you are eligible to receive the COVID-19 vaccine. If you go on our website at the yakimahealthdistrict.org, you can click on our COVID-19 vaccine page, and then here you'll be prompted with more information. So currently today we are in phase 1B tier 1. So these are the individuals that are present. Beginning tomorrow, March 17th, these individuals will be eligible, my apologies, which is high risk critical workers who work in certain congregate settings, which is agriculture, fishing, vessel crews, food processing, grocery stores, corrections, prisons, jails or detention centers, public transit, remaining first responders, people 16 years or older who are pregnant or have a disability that puts them at high risk for severe COVID-19 illness. So these individuals will be eligible starting tomorrow, and they can schedule their appointment today for tomorrow. And let me go back to our health district page. So right below this graphic, we will have more information on upcoming community vaccination events occurring throughout the community. There's none at this time, but we will definitely update this if there are some that are occurring throughout the week or the weekend. And then here is a list of the current vaccination sites that are scheduling for a COVID-19 appointment if you are eligible. So here's the location, the address, and the registration. And then for the opening of the Yakima County Browns drive-through community vaccination clinic, there is information on how to register. Like Nathan had mentioned, people will need an appointment to access this site. And in order to register, individuals will need to go on PrepMod. If you go ahead and click PrepMod, it'll take you to this page, and there you'll be able to sign up for a COVID-19 vaccination appointment depending on the day you would like. If individuals do not have access to the internet, there also is a phone number you can go ahead and call. And that phone number is 1-800-525-0127. And there they will help you schedule your appointment. You can also give us a call here at the Yakima Health District office at 509-575-4040. And we can give you a list of information of locations that are currently scheduling. There's also transportation available for individuals who do need help getting to and from their COVID-19 vaccine appointment. And that phone number is 211. So we encourage everyone to please share these resources with individuals that would find this helpful. Okay, and is there any other additional comments any of you two would like to share before we end our COVID-19 update?
I would just like to say it's really nice that we're getting those vaccines in, and it's really exciting to see the drive-through clinic up and running tomorrow.
Okay, thank you, Dr. Yega. We are excited to have that vaccine site open tomorrow. And let me check our Facebook to see if there are any last minute questions. Okay, so looks like no one else has a question. So this is our update for tonight. Please join us on our next update on March 30th. On March 23rd, which is next week, we will have our Spanish update. Thank you, Dr. Yeka and Nathan, for your time and for being able to be here this evening. We will see you in 2 weeks.
Thanks.